Hey everybody, Dr. Kevin again here, and welcome to day 8 of our spine rehabilitation program series. Over the course of 30 days, I hope to show you how to create a comprehensive, full-body spine rehabilitation program from complete scratch in ways that I believe are the safest, simplest, and most effective ways possible. Again, this just is a culmination of the past 12 years in working with a lot of patients who've been struggling with various neck and shoulder or lower back conditions, and just sharing with you what I believe has just worked best for my patients, and also what has worked best for me personally in having to rehab some pretty serious neck and lower back injuries myself. So in day 7, we started to explore some new territory. We started to introduce a concept known as anterior pelvic tilt, and how that can be one of the main driving forces behind what's actually at the root of what's causing lower back pain in ways that people may not be aware of. And that we also started to introduce some concepts of how to start to stretch and start to relieve pressure off of your lower back by stretching and relieving tightness off the muscles in the front of the hip. So day 8 is going to be a continuation of some of the topics we went over on day 7, but we're going to be going over a new technique, and we're going to be showing you how to use this foam roller, specifically applied to the muscle in the front of our thigh known as our quadricep. So the quadricep muscle is again one of the most overlooked but also problematic muscles when it comes to lower back pain, because I also believe that is at the root of what's driving a lot of this anterior tilted or sway back type of posture. And that when we're able to identify tightness, relax the strain of that muscle, it's just one of the most effective ways of actually releasing pain and pressure off of your lower back that I've seen. And a lot of my patients are also very pleasantly surprised when that actually is the case. So one of the most important tools that we have at our disposal in order to help release tightness of that muscle is this foam roller. And I know for a lot of my patients, specifically when I bring up the concept of rolling up their thighs or rolling up their legs, they kind of just moan and groan and say, "Oh no, not this thing again." If you've never been on a foam roller, when done incorrectly, it is quite painful. It doesn't really do much, and a lot of people just kind of throw the towel in and it's just, okay, I'm not going to deal with this. But that's why in the first part of the video, we're going to go over some of the underlying physiology behind how we want to approach foam rolling, and just to make sure that we help maximize the effectiveness out of the treatment. This foam roller was something that I also initially hated to do. I didn't really see a lot of value or a lot of utility in it, especially in the beginning of my career. But as time went on, as I started to understand muscle physiology at a greater depth, I started to realize that, okay, this thing can be one of the most effective tools that we have at our disposal to increase mobility, increase flexibility within the muscle very, very fast in a way that will help just support a lot of the things that we want to get accomplished in rehab. So that'll be the first part of the video, just me explaining some of the, again, underlying physiology behind how we want to approach using the roller, and then followed by about 8 to 10 minutes, just explanation of how to actually apply the roller onto your thigh. Okay, so for the first exercise for day 8, we're going to be going over how to effectively foam roll and reduce tension in the muscle in your thigh, known as the quadricep muscle. Because again, this is a very, very important muscle because of the very important attachments it has onto our pelvis. So our quad muscle attaches from the top of our pelvis all the way down to the bottom of our knee. And when this muscle is very tight, similar to the hip flexors, it is one of the main driving forces behind this very very painful muscle imbalance syndrome known as anterior pelvic tilt, where with severe anterior pelvic tilt, it's just one of the most common causes of lower back pain because of the amount of pressure and strain that it puts on the lower back. But when we're able to help relax tightness or release tightness and increase the mobility and flexibility of this muscle, it's one of the things that has worked the best in terms of relaxing and releasing tightness off of the lower back. So before we get right into the roller, I just wanted to introduce a very, very important concept about foam rolling that you just may not be aware of. This is one of the things that really resonates with some of my patients, so I want to explain this theory and concept with you as a means of helping you understand what are the goals with the foam roller, what we want to get accomplished, how it actually helps increase the flexibility and mobility within your muscles, and how it can really augment and really support any stretching that we want to do for this muscle. So to explain the concept of foam rolling, I'm going to use this elastic, just kind of resistance band. So I want you to imagine this band is just any typical muscle that has two attachment points, okay? Now this orange stretchy part here would be my muscle tissue, and this attachment point, this hook, is known as the tendon in which our muscles attach onto our bones. So as you see here, most muscles have two attachment points and it attaches onto the bone via these tendons. Now, in a normal, healthy muscle at rest, the muscle should be in a relaxed state. And when a muscle is in a very relaxed state, it doesn't feel very tight because it's not really working that well, or it shouldn't be working when it's at rest. However, what we find for muscles that are either overworked, they're not stimulated enough, or they're just generally unhealthy, our muscles have this weird tendency to find ways to just kind of shorten or just tighten. And one of the phenomenon that happens to these muscles is they start to form these very strange knots within the muscle tissue. Okay, so I'm going to tie a couple knots within this muscle just to illustrate the point a little bit further. Now, anybody that's felt just hardness or just tightness in the muscle, you might know what I mean, just in terms of this feeling of these just muscle knots forming within your body. So I want to explain how we can use something like a foam roller to actually release some of these knots over time. So, but in general, what happens if I tie a bunch of knots within this muscle, what happens to the length of the rope? The rope starts to shorten, okay? And when the rope starts to shorten, instead of it being in a very kind of relaxed position when there wasn't a lot of knots in there, all of a sudden there's going to be just generally more tension within that muscle. Now, most people, when they talk about tight muscles, their main approach to relieving tight muscles is just through stretching. Okay? Now, stretching in general is generally considered a good thing, but in the presence of a muscle that has a ton of knots tied in the middle of it, this may not be the most effective strategy at actually increasing the mobility within the muscle, because look what happens if I try to stretch this muscle if it has a bunch of knots tied in the middle of it. Okay? Yes, temporarily I may feel this elongation, I may feel this stretch, and it might feel like what my body needs, but what's going to happen to these little knots here as I start to stretch? The knots might actually start to get a little tighter, and when I actually release that stretch, it's hard to say whether or not I've actually gained flexibility within the muscle, okay? So how we want to approach the foam roller is a means of just understanding that there could be these kinks, there could be these knots, there could be these areas of just increased contraction, increased restriction, just overall levels of just tightening and shortening within the muscle that could be preventing us from being able to get a good stretch. So we want to use the foam roller as a means of identifying where these knots actually are and start to use that pressure that we place on our muscles through the roller to start to relax the tension, release the pressure within these knots to ultimately relieve the pressure in the muscle so that we get a healthier muscle. So there's a lot more depth of neurophysiology of why these knots happen, and I don't want to get into all of the complexities today. I will be uploading videos like that on this channel at some point. But just for the sake of understanding what we want to get out of this foam roller, I just want to introduce the concept of the foam roller helps identify and release knots within a muscle, which could be what's holding the flexibility back. And when we use this roller to relieve those knots, it's one of the things that will really help augment and help support our stretching and really help fast track the improvement of mobility within muscles to, again, take pressure off of your spine and take pressure off of various parts of your body. So that's it for just the underlying concepts of foam roller with regards to helping relieve muscle knots. So let's get right into actually how to actually use a strategy to release tightness within our thigh muscles, to take pressure off of our pelvis, to take pressure off of our back. So let's get right into it. So I just want to show you what I believe is the most effective and most appropriate way to actually foam roll your legs to maximize the effectiveness that will actually help you get some results. So I would say that the most common mistake that people make when they try to roll their leg or they try to roll their thigh is they're just kind of treating it as this like deep tissue massage type of thing where they're just kind of rolling up and down, just inflicting pain, just inflicting pressure. And the mentality that a lot of people have of this no pain, no gain mentality for something like this just doesn't work. So again, if you're gonna foam roll, I don't advise you just kind of roll up and down your leg. I don't know if that really does much of anything, but I do know that this strategy worked really, really well. This is something that I learned when I was overcoming a back injury, a very serious herniated disc on my own. And it was just one of the most effective ways at relieving pressure off of my hip, which took a tremendous amount of pressure off of my back, which really helped me get through a very, very tough time many, many years ago. So I want to share some of these strategies with you with hopes that it may help you in the same way that it has helped me and the same way that it's helped a lot of my patients as well. So the best way to approach the foam roller is, again, just to start in this position here, I like to have one leg up and obviously putting some pressure on my right leg through here. And I'm going to use my arms, going to use my hands here just to try to mitigate and just to control how much body weight goes into the roller, because that's ultimately going to impact how much I can tolerate. All right. So the best way to do the roller is, again, just incorporating a lot of the strategies and principles that we've gone over thus far, which is to just gauge our breathing and to use our breathing just to guide us through the exercise. And I would say that breathing on the foam roller is even more important and impactful than breathing while stretching, right? Because again, it's one of the ways that we can start to identify and release those knots, release those areas of high concentration of pain, tightness, and inflammation, and just find ways to just disperse that pressure, to release those knots, to just have a longer, more relaxed muscle. So what I want to do here is just start at the very top of the muscle, which would be at the top of the hip. And you can start by either working right on the front of the muscle, in the front of the thigh, known as the rectus femoris. But I find that it's easiest just to kind of start on the middle/side area. There's also a lot of tightness that we find for a lot of patients in the area known as the IT band. So we can work on that as well. But I would just kind of start maybe just in between the direct front of the thigh and the side of your leg, so right in the middle through here. So again, starting at the top of the roller here, I just want to do a very, very slow scan all the way down the muscle. And as I scan, as I roll, what you will find is that there will be parts of the muscle which just feel so much tighter, so much more painful, and so much more sensitive than other parts of the muscle. Those areas where there's a high concentration of just tenderness and tightness, those are the trigger points. Those are the knots. Those are the areas where we actually want to focus our attention when on the roller. The mistake that a lot of people make when they're on the roller is they just feel one of those spots and it's like, nope, that's too painful. I'm just going to get it right off of that spot and just move on to the next. What we actually want to do is identify where those spots actually are and just stay right there. Okay. Now, it might be more painful. It might be more sensitive. It might be very uncomfortable. And that's where we want to use our hands just to be able to relieve a little bit of pressure off of the muscle, just so that our bodies can start to just have a little bit of time to just adapt to the pain and just to adapt to the pressure. Okay. Now, what you will notice when you encounter one of these spots, right? It's going to hurt. It's going to feel tender. It's going to feel sensitive. But what you'll also notice is that your breath will start to shorten up, right? Your body's going to start to sense threat. Your nervous system is going to be on alert. It's going to be alarmed. And that's what's going to cause that just kind of tightening, kind of shallow breath, just kind of, stressful situation. So at that point, try to take a deep breath in through your nose, out through your mouth, and just very slowly try to relax tension relax the pressure into the muscle. Okay, let's do it again. Exhale. And just relax into the muscle, okay? So again, the most common mistake that people make when they find these points is it's so painful that they just roll off of it. But what I want you to do is to just take some of the pressure off the muscle to the point where you can start to regulate and be in control of your breathing, and then use your breathing as a guide to be able to eventually sink more pressure into the muscle to the point where you start to be able to relax the pressure, you get to relax the tension, and you're actually able to start to learn how to untie and release those knots within the muscle. Okay, let's practice again. Inhale and exhale. Okay, now I don't want to stop there because I want to make sure that I'm trying to identify all of the different knots within the muscle. Okay, now just for the sake of comfort, I'm just going to switch sides a little bit just so I can just have a little bit of break from the position. Okay, so again, I'm going to start at the top of my hip and I'm going to very slowly roll my way down the leg until I start to feel a part of the muscle which just feels really tight, really tender, and I feel one right about there. Okay, and again, I'm going to take a little bit of pressure off of my leg here. Let my breath catch up. Take a couple of nice deep breaths in. Exhale. And just eventually learn how to sink more pressure into that muscle. Another deep breath in. Exhale. And just relax into the pressure. All right. Even there, I felt a little bit of a knot in that thing. I could just literally feel just kind of melting away. And now I'm just able to sink as much pressure as I want into it. Now, this is something I've been training my body to do for years. It's a skill that I've learned, and it's one that I'm very familiar with. So it's again for a lot of people, especially in the beginning, and this was like me in the beginning. It's quite painful. It doesn't feel very good. But I promise you, if you're able to stick with it, if you're able to start to condition your body to the point where you're able to create some release within that muscle, I promise it's one of those things that will just help relieve so much pressure off of your hip, which will release so much pressure off of your back. And it's just, again, one of the most most impactful things that I've ever come across in terms of spine rehabilitation. So let's move on to another knot. I feel one right there. Quite nasty, quite painful. And I just want to sit there, take a couple of breaths, exhale, and just relax into the pressure. Again, I don't want to just roll and mash and just inflict pain on myself. I want to learn how to identify areas of the muscle that feel tight, feel tender, use my breathing as a means of relaxing the local nervous system response, and just try to unwind and relax the tightness within that muscle. Let's do it one more time. Okay. And we'll just roll down one more spot along the way. Find one right there. Deep breath in. Exhale. It might take many attempts. It might take several breaths, and you may not really get it the first time, but that's okay. What I generally tell my patients, the more painful, the tighter, the more uncomfortable you find your thigh muscle is on this roller, the more you actually need to do it, and the more benefit you'll be able to get when you actually are able to relax the tightness within that thigh muscle. Okay? One more breath in. Exhale. And just sink a little more pressure into the muscle. So again, foam rolling, I believe, is it's a skill, and it's something that I've just kind of built up tolerance for over the course of many years. But again, having a back injury myself many years ago, me noticing my thighs and my hips were just insanely tight for various reasons. This exercise, this drill, was one of the absolute game changers for me. And one of the things that, carrying on some of these ideas and some of these principles for some of my patients has been a game changer for them as well. When we were actually able to identify that as a problem, and when we're able to release all of those knots and all those trigger points with the roller, again, I hope that it has the same result for those of you out there as well. So That's it for foam rolling the quads, and let's get into how to stretch those quad muscles to, again, give you further release from your spine.